So right now I'm going to be demonstrating how to auscultate the heart and lungs on a dog, on a canine. My patient here has come in today for having a little trouble breathing. He seemed to have collapsed at home. So the first thing that the doctor is usually going to check on a physical exam is the heart and the lungs. When I listen, I'm going to be listening for the 4 valves. So the pulmonary, aortic, and mitral valves are on the left side, and the tricuspid valve is on the right side. And when you're listening, you want to make sure that you listen for all 4 valves. So starting on the left side, working with the pulmonary, which is closest to the elbow, the aortic, and then the mitral going back, and then going to the right side and listening for the tricuspid valve. There are usually 2 heart sounds that you listen for. The first sound is usually associated with the lub sound, where the second sound is associated with the dub. So when you listen to a heart, you're hearing that lub dub. Those are in reference to the closure of the mitral and tricuspid valve as well, and the second sound is related to the closure of the pulmonary valve. So, so I will be starting to listen. So I can already tell just by placing my stethoscope that this dog has a heart murmur. I can hear a very loud swishing sound. So when you are grading heart murmurs or abnormal sounds, you are grading them by the sound, but also the intensity of how and placement of where it is. So I'm just going to listen a little bit more just to see where I can place it. So listening to all parts of the heart, I can definitely hear it on both sides, but I hear it more intense on the left side, and I do believe that it's closer to the pulmonary valve. Loudness-wise, I would grade this on a scale of through 1 to 6. I would grade this at a 5. I can also feel it through the chest, like it's very intense. And then when listening to the lungs, you want to listen to the lungs through 9 quadrants. So when I listen to the lungs, you, especially in a dog that does have abnormal heart sounds, you want to listen for any abnormalities. That could be an indication of fluid or pneumonia. At first, when I had briefly listened, I did not hear anything like crackles or anything that could be associated with fluid, but I'll take another listen. The lungs sound clear, I would say that's a good sign in this case for a dog that does have an intense heart murmur, and I would advise the doctor of where I have the scale of the intensity of the murmur as well as the loudness, and would discuss with the doctor any further diagnostics we would do for this patient. Thank you. So Cheese here is going to help me show you how to read an ECG. We're going to start with the placement and the positioning of the patient. So ideally for reading an ECG, you have them in right lateral recumbency, so we're going to start with that. Oh, such a good boy. So now that he is on his side, we're going to start by placing our ECG leads. This usually are labeled, but we know that the white prong here goes on the right arm. So since we're on our right side, black is on our left arm, and red is on our left leg. And we're putting the hind limb prong right above the stifle, a little bit higher than the stifle. And these two leads are going above the tarsus on these arms. After they're placed, you're going to spray them with alcohol so that they can breathe. Because our friend is hairy here, you do have to spray him a little bit more. Now that we have a actual waveform forming, which is actually the amplitude of the electrical currency going on in the heart as well as the duration, we're looking at what's called the PQRS T wave, and you're looking at kind of the contractions of the valves themselves. So I do want to mention also that this patient we do know has an existing heart murmur, so his EKG may still be kind of abnormal. So to eliminate artifacts, I've placed him on a non-metal table here, so the recording can read. His ECG, his heart rate is normal, and his waveform does look normal. Ideally, I would expect to see the ST wave to be a little bit longer, have a little bit more space in between, which is actually forming now, which can be because he's also relaxing.
So Walter here is going to help me demonstrate how to use a restraint pole. We try not to use these too often because we try to get here for a hospital, and these tend to be in more extreme cases if you have a very aggressive dog or a dog that can't get near. In this case, I'm using Walter, who is a very friendly dog. If it were a dog that I could not approach, I would expect to see him, maybe growling, tail down, really just unable to just get to him. I would probably not have a lead on him. So if he were, I would expect him to be pretty far away. I'm using a snappy snare as my restraint pole, and the way this works is that it has a very bendy restraint here with the snare itself, and you bend this all the way down, so you almost get like a fishing hook. And then as you approach the dog, you can put it over their head. So, Walter. And then you let go, release, and now you have the snare. I guess the major complaint with this is that it's very bendy, so if you do have a very aggressive dog, it will move around with the dog more. At that point, if you're able to have another firmer restraint pole, you can also put that around the dog if you have a good control, and then you can release it by putting the firmer stick, the harder stick, through the loop there and taking it off the dog. And that is how we use a restraint pole. So I'm going to be catching urine on using Walter here, my assistant. It's a male dog, so we're going to be trying to catch urine on him. Free catch. I'm using a sterile urine cup. That way, this is not a sterile sample, but at least it'll stay as clean as possible. We've cleaned his prepuce inside using a Carhack scrub, and I will be trying to catch it midstream. That way, there is the least amount of bacteria present. Started urinating. I caught it midstream, like I said, to minimize the presence of bacteria from the outside of his prepuce. And then this is a sample that we will run in-house. So today I'm going to be demonstrating how to properly clean and disinfect a cage here at our animal hospital. The product that we mainly use here is Rescue brand. It is the major ingredient in there is accelerated hydrogen peroxide, and it can take care of a number of different viruses. For example, as it shows you right here, for example, it takes care of different forms of Bordetella, E. coli, staph. It also does FIPV. It also can take care of listeria and different forms of salmonella, depending on the amount of contact time. So the first thing that you would normally do is remove the patient and any debris that were in here. So this was actually a clean cage, but if there was anything like stool or urine, you would clean that separately. And then to clean and disinfect,
you remove a wipe from the canister, and then you want to make sure that you clean every single surface of the cage. So that includes the floor, the 3 walls, the top of the cage, because if anything is airborne, can get to the top of the cage, and also the door as well. So when I'm wiping this, I'm making sure to just go in an even pattern up all walls. And for this product in particular, it asks that to truly be disinfected, the contact time be 1 full minute of it being wet, and then allowed to air dry. Make sure to get all surfaces of the cage as well as the door. I usually start with the horizontal bars and then work my way down. And then allowed to dry, and don't place an animal in the cage until it is properly dried and ventilated. And that is how we disinfect a cage. So she's here is going to show us how to catheterize a male dog and collect urine as a sterile sample. The first thing we do is we put him in right lateral recumbency. We have his penis out, we clean his prepuce, and we are just going to clean his prepuce as well as his penis. This will keep it as clean as possible. Try to get any hair out of the way. Now because we want this to be a sterile procedure, we need to keep our field as sterile as possible. So I'm going to start by creating my sterile field. My urinary catheter is here, and I'm going to just carefully open that up. Not all the way, but just to start my field. Get my sterile lube out. The syringe I'm going to use is also sterile, so we're just going to drop that in here. And now I'm going to start by putting on my gloves. Now I can touch the inside of the glove, but I cannot touch the outside of the glove, so we're going to start with my right hand. Keep this like this. With my right hand, go underneath to the inside of this glove. And now use this hand to pull this all the way down. And now I am sterile. So I'm going to take my urinary catheter here, put it through our lube, make sure it's nice and lubricated for our patient. And while my assistant here has already held his penis out, I'm going to place the catheter into his urethra very gently, making sure that I don't feel any resistance. I do feel a little resistance. There we go. Okay. I'm so sorry. There we go. Mixing it gently. You want to make sure that you push it all the way to the bladder as smoothly as possible. Now I can take my syringe here and see if I can get any urine collection here. Pulling just a little bit, not putting too much pressure on, and I do have some urine coming, so I'm just going to pull back a little bit more. That's enough. And then just remove my catheter, and that is how we collect sterile urine from a male dog. So today I'm going to be demonstrating how to perform a cystocentesis on a female cat. The reason we're collecting the sample is because the cat had previously come up positive for a urinary tract infection, and after being on antibiotics for a period of 2 weeks, we are now recollecting a sample to send to the lab to see whether or not we were successful in treating it or not. In this case, I'm collecting the sample sterilely by performing a cystocentesis, which is when the technician or doctor will palpate the bladder using one hand and insert a syringe directly into the bladder with another hand. This creates a sterile technique in that you're collecting the urine directly from the bladder. So to do this, I have my technician here holding the cat in right lateral, extending the hind limbs as far as possible. With my left hand here, I'm palpating the bladder, pushing it dorsally and caudally, pushing it up against the pelvis to keep it in place. And I can palpate it here, and I can feel that it's nice and balloon-like, nice and large. If this was a smaller bladder, then you typically would either use help with an ultrasound or not poke. So now that I can feel that I'm nice and secure here, I'm going to use some alcohol and clean my area there. Using a 22 gauge needle on a 3 ml syringe, I'm going to be poking or directing my needle at a 45-degree angle.
Hello?
Yes.
Hi, can somebody
And
walk
collecting
over
my
for me?
sample.
See again.
Yes.
Thanks.
Okay. And then taking my needle directly out.
Right now I'm going to demonstrate how to run a Schirmer tear test. We do this in patients that are experiencing a lack of tear production, so they get a lot of mucus build up in their eyes, or a lot of kind of that gunk that mixes up with their fur. The way we run this is by using a Schirmer tear test, which is a piece of paper that runs on millimeters, and it has a notch here that you can bend. So not the blue line, the notch here that you can bend and put directly in the eye, and it's not invasive at all. It doesn't hurt, just maybe feels a little funny. And we put this, I'm gonna lift his here, puts this directly into the eye, close the eye, and then we let this stay in the eye for a minute
while the tears that are in the eye run across the blue line that was there and shows us the amount of production. So we'll let this sit for a minute.
Okay. Oh boy. So after a minute, we are above 15, which shows us a good tear production. So there would be no need for any medication at this time. So this time I'm going to demonstrate how to use a tonovet and get an eye pressure of our patient. You get an eye pressure or the intraocular pressure of a patient when you're worried about things like glaucoma. And what that is the layers of the eye pushing up against and forming some kind of pain. So to use this, you use the tonovet here, which is the tonometer, and a probe that we actually put to the eye. Before we do this, though, we are going to put just a little numbing liquid here. This is tetracaine. So I'm just going to put 1 drop in each eye. Wait about a minute and then start running our test. So now that we've waited a minute for the tetracaine to set in, we're going to run our test. So you use this by putting in a probe into the tonovet and turning it on. And this probe is actually going to hit the eye 5 times and give us a pressure. So now when I'm holding the face, we're not putting any additional pressure on the eye itself, because otherwise that can actually interfere with our test. I'm just going to hold the lid open a little bit and want to get it as straight as possible. Well done. Okay, so that was a 12. That's a low deviation of 16. Low deviation of 15. So all those numbers are around the same area, and that was for the left eye. So now we'll start with the right eye. Probe. Hi, buddy. 17. 15 and 15. So there's a low deviation of 15 and then now a normal 15, and those are all nice normal numbers, a normal amount of eye pressure that you want in the eye. That's how you get the eye pressure of a dog. So right now I'm going to demonstrate how to use a fluorescein eye stain to look for any abrasions or scratches on the cornea. The way we do this is in a number of steps. First, we wash out the eye with some with some saline eye flush, just to get if there's any extra mucus or any hair out of there. Clean that out a little bit. And next, we actually take the stain, which is this paper here. And actually touch it directly to the eye itself, and it will stain the eye. Okay. Then we flush out the eye again. And now this stain will actually produce as a bright green light that shows up in the dark if you use a black light. So if I take this black light to it, you can kind of see that the green in the eye is much brighter than it normally would be. And what you're looking for is kind of any sort of obvious, what can be divots or scratches in the eye. So I don't see anything yet, but I'm going to turn off the light. And just double check myself that I don't see anything. So now you can really see that there's no obvious imperfections in the eye. And then we finish off our test by just washing out the rest of the flush. So I realized when reevaluating Cheese's eye here that I did actually miss an imperfection here. Now I'm not sure if that is an ulcer or anything, because it's not kind of an obvious scratch or divot, but it is definitely an uptake there. So we're going to let our doctors know that we have found something there, and they're going to advise us further. Now I'm going to demonstrate how to express anal glands in a dog. Anal glands are very similar to the scent glands in skunks, where when you have a nice firm stool, or when a dog passes a nice firm stool, they express their anal glands usually as a scent marker. Anal glands are located inside the rectum at the 5 and 7 o'clock positions. To express these glands, you put on a glove and usually lube up your index finger. It's usually easier to get to there. And now with a towel or gauze, go directly in, not very far. It's usually just close, okay? So now I can feel this left one here is just a little bit full, and if I just apply a little bit of pressure, okay? And I can turn and go to the right one, and again, a little bit full, it's about the size of a pea, and if I apply a little bit of pressure, just constant pressure, I don't want to push too hard, because in the event that there is an infection or anything going on, it can cause more damage, okay? And you can see that in this patient's anal glands were very thick, so that's why it does take a little bit longer, but that is how you express anal glands. So today I'm going to explain how to give an enema to a dog. At this point, this patient here does not actually require an enema, so I'm going to be doing all of the steps up to leading the enema and explaining kind of the method of administering the enema. My tools that I have provided here are a treatment bowl. I have some lube here, some lactulose, catheter. It's a red rubber catheter, so it's very bendable, and a 20 ml syringe. So the way we make an enema is by mixing warm water, lube, and lactulose. So the warm water, you don't want to be too hot, just enough so that it just it's mild on your skin. So I'm going to go fill our warm water now. Warm water will as well help break up the lube. And then you're going to mix this with a lot of lube. Give us a kind of a little splash of lactulose. So now that the enema is a good consistency, it's very lubey. It is with warm water. You, depending on what the doctor feels is necessary for the patient, is the amount that you would administer, draw up, and administer. So if this were a very like an obese feline that hasn't defecated in a number of days, and we take an x-ray and we see a very large amount of stool in the colon, then we would probably give a little bit more enema, administer a very small amount. In this case, I'm going to draw up, for this, for a size, patient this size, would probably draw up about 15 mLs. So I have a 15 ml syringe here, and I'm going to red rubber here. And I also have a catheter adapter here. Put on the thicker end of the catheter to help our syringe stick to it. Now the other thing too to remember is that you want to push the enema itself through the catheter before you start to administer it, so that you're not pushing a lot of air back there. The next step is actually administering the enema. So what I would do is I would have my patient sternal, lift the tail. I would provide a lot of lube on the catheter itself, and I would insert the most of the catheter into the patient. So now this is, I guess I could do this way. So because this patient doesn't need an enema, we'll administer it through, we'll pretend to administer up here. So after placing a lot of lube and placing a lot of lube on the rectum, I would try to force it kind of directly into the rectum, and go toward the, through the descending colon. You don't want to, now A patient this size would not have this much catheter going through, so you also want to make sure that you're only putting in enough catheter for the appropriate size. So I'd push it, try to get it as far in as I can, depending on how hard the stool is. I would be pushing the enema through my catheter, and then as well as pulling it back. So I would be put it in, administer the enema, and kind of pull back at the same time as I'm administering it. That way it's almost like a flushing. And I would only do about 15 mLs in this patient. We would put it in a cage, and we would monitor it and see what kind of stool we would get. And that is how we perform an enema.
You see here is also going to help me demonstrate how you apply a topical medication. In this case, we're going to administer Revolution, or pretend to administer Revolution, which is a topical flea and heartworm preventative. So, flea and tick preventative. In cats, you want to do it as high up on the neck as possible between the shoulder blades, because cats are very flexible. You don't want them to lick the medication off, so you try to do it as kind of up here as possible. You also want to make sure that you part the hair as much as you can to get the application directly onto the skin. The reason you want to do this is because this medication works with the glands of the skin. So when you would administer it, just kind of place just here. We are using water, so it's a little bit more liquidy than Revolution would be. But that is how I would explain to a client how to administer Revolution. So Lois here is also going to help us show how to clean a cat's ears. Typically what you would use is either a gauze or Q-tips, and the Q-tips are not going in the ear, they're just kind of using around the crevices. And I also have just a kind of plain ear cleaner here. I'm just going to place a little bit on this gauze here to demonstrate, and go directly in. Now most cats do not like this, most dogs don't like this, but it's okay. We're just kind of cleaning any debris that's just on the outside. You can also take this as well, I'm going to close it, take this as well and put it directly into the ear. Give it a good rub, let them shake, or also kind of scoop out any excess debris that you break up from within their ear. Cats and dogs' ears are shaped like an L, so a lot of debris gets stuck in this bend here. If I take my Q-tip, there's a lot of crevices here, so I can go around here and kind of scoop out anything that's extra. When medicating, you want to make sure that the ear is as clean as possible. And for example, here we use Trazodone a lot in cats, which has an antibiotic anti-inflammatory properties. And this is a liquid medication that you just would pour a couple drops in directly into the ear. So I would explain to a client or an owner that I would take this medication and pour it directly into the ear, give it a good rub, and that is how we clean and medicate cats' ears. So now we're going to demonstrate how to clean a dog's ears. Dog's ears have, the pinna is the flap that you normally would see, or if they are straight dog's ears, like Chihuahuas, they usually come up straight. That outside part is called the pinna. And the ear canal inside the dog's ears are usually shaped like an L. So a lot of debris kind of gets stuck down here in this bend. So when you clean a dog's ears, the same with people, you don't want to apply a Q-tip or anything like that really far in the ear, because if there is any wax or debris, you're just going to kind of mash it in. So when you're cleaning a dog's ears, you use usually a non-medicated ear flush. So in this case, I'm going to extend the pin up, pull it just straight up as I can, and then put the ear wash directly into the ear, massaging the base of the canal, really getting it to work in there and break up any debris if there's any in there. And then with a gauze or a soft tissue, just kind of scooping out any debris that's in there, which there really isn't. These are nice clean ears. So as you can see, they're not very dirty. And I usually just do that a couple times just to make sure that I get any of that liquid out. The other thing you can do as well, if you notice that if there is any debris on the outside of the pinna, you can use a Q-tip just in kind of the crevice or the kind of the bends here. So if there was a little bit of debris here, you can do that in case your finger is too big. But that's all finished. And that is how you clean a dog's ears. So right now I'm going to demonstrate how to administer subcutaneous fluids to this patient here, this cat. She
gets these administered every 2 to 3 days, and her dose is 50 mLs for her weight. So I'm just double checking my bag here. We're by the, in between the 2 and the 3. So I'm just going to stop at the 3. I have an 18 gauge needle here, and I'm going to make a tense with her skin here. Look for my subcutaneous space and just poke. My assistant that's holding here is going to just hold that in place just in case. Make sure it's in and administer her fluids. And now you can see that she is getting a little bubble here as the subcutaneous space fills with fluid, and that's how you administer subcutaneous fluids. Going to help me demonstrate how to cut a cat's nails. We're going to start with our hind legs here. Lisa here is holding her in right lateral recumbency, holding her scruff down, and holding her hind legs together. When you're cutting a cat's nails, typically they can be white or almost clear, but they can be black. So when you're cutting a cat's nails, you're looking for this pink or this quick here. That is the blood supply in the vein and will hurt if you cut it. So you want to make sure you don't cut it. So when I'm cutting just before that, very quickly here with these nail clippers here. I'm also pushing in the paw pad a little bit so I can have as much nail exposed as I can. If I do manage to get too close and make her bleed, I can apply this quick stop, which is a styptic powder. Essentially cauterizes the blood supply. I usually do that and either pour it in the cap here or apply a little bit onto a Q-tip and just gently touch the nail, and that will help stop the bleeding. But that is how we cut a cat's nails. So right now I'm going to demonstrate how to cut a dog's nails. Dog's nails have two components. They have the nail and then they have a blood supply in the nail itself. So when you're cutting a dog's nails, you want to make sure that you're aware of where the blood supply is. It's called the quick. In most situations, dog's nails can be white or black. Most of the time they're usually white. And you can see the quick, which comes up as almost like a pink line in the nail itself. In this case here, we have a dog that has all black nails, so it does become a little bit more difficult to cut. So in this case, what I'm looking for, I'm going to demonstrate it actually on this hind leg here, is this little hook here. So I'm not going to go too far because again, I can't see the quick. I don't want to cut the dog's nails too short, but what I am going to cut is this tiny little bit right here where it kind of hooks off. So then we just go like that, and it's nice and short. Some of these other nails probably don't necessarily need to be cut. If I were to cut a dog's nails too short, it would hurt and it would bleed, so I would apply what's called quick stop. If it were to bleed, I would place a small amount in the lid here or on a Q-tip. Lift the paw up that was bleeding, so for example we'll say that it was this nail here, and place it directly into the quick stop itself. This acts as almost like a cautery agent and helps stop the bleeding. And that is how you cut a dog's nails. So my patient here, Cheese, is going to help me demonstrate how to put on a bandage for a pressure bandage. So we're going to pretend that he had a mesh removal over here, and he cannot keep a cone on or cannot put a chaser on, so we're going to put a little pressure bandage. So the first thing that we're going to do is place a non-occlusive, use our non-occlusive layer, which is going to be a Telfa pad. So if he had something like sutures or staples, you would want to put something that's non-absorbent, and that would be our first layer here. The second layer is our padding, and this just kind of keeps everything in place. So I'm going to start by wrapping around, keeping the Telfa pad nice and straight, and doing everything by a 50% overlap. And I'm also, it's a pressure bandage, but I'm not making it too tight. Okay. Our third layer is going to be this cling wrap, and this kind of holds the support in, as well as, again, keeps everything in place. The same rule applies where you're kind of layering it 50%. This third layer as well also kind of determines how much pressure is actually getting put on to the wound itself. And then for the last layer, which is still kind of considered a tertiary layer, we're going to apply some vet wrap. And this is just kind of to keep everything, hold everything together and really keep it clean. It would still be up to an owner to keep this bandage dry, or as dry as possible, and to be compliant with coming back in for us to check the wound itself, because the wound itself can become moist, and we want to make sure that it doesn't brew infection. I have started by taking the vet wrap and loosening it so that when I am peeling it away, I'm not making it tighter as I apply it. So I'm going to start back here, leaving a little layer of telfa out, not telfa, cast padding out, and just pulling it lightly across. Like so. So now this is not so tight where he can hurt himself, because as you keep this on, it can tighten, and he could have any trouble breathing or anything, depending on where it is. This is nice and tight where I can stick my fingers underneath it, but it'll holds the pressure well. And that is how you apply a pressure bandage.
Very cute.
So, right now I'm placing a splint on our patient here. He has a fractured radius on his front arm, his front right arm. So the first thing that you do is place your stirrups that comprises 2 pieces of tape. The first layer that we can use it later on. The doctor has asked that I place a light layer of
They're both everyone's speaking.
cast padding on before I use
He's
the
insulted now. Look at him. I'm insulted.
I'm gonna
splint on. So I'm just going to do a very, very thin light layer here. Going up to the first joint.
Him?
Then placing my splint on. The splint has already been sized because we have been already splinting the patient. The next step is placing another layer of cast padding, starting at the distal end and working proximal.
They said he doesn't like his ear touch.
And this layer will be tighter
Look at his lips, but I tried to listen to
and a little bit thicker.
Yeah, no, don't. And they actually told me, they're like, he doesn't like his ear touch. Very unpredictable. Do it. Oh, you're good. I haven't heard him cough all day. They didn't even bring him because he's been coughing recently.
Leaving a little bit of the toe exposed.
Sounds like he had a single episode this morning. Hi, you're very cute. Like that's why they the dog laughs. Like a puppy. It's like I need almond.
The third layer is I'm applying is to hold the cast padding in place. And every time you overlap this, you do it about 50% all the way up the leg. Finally, using the stirrups that you set first. One second. I know, and this will help hold the bandage in place. I know, baby, I know, I'm sorry. And then the last layer, the outer layer, is your vet wrap. Again, starting at the distal layer, and working our way up. I have loosened this already too, so I don't pull unnecessarily, and also so it doesn't become too tight. also, in this case, going to cover just a little bit of the feet there. When you're normally placing a bandage, you don't want to cover the feet. The doctor has X'd in this case that I cover the toes. And then finally, I'm just going to put a small layer of tape at the bottom to secure the bandage in place, the bat wrap in place. And that is how you place a splint with a Robert Jones bandage on a patient. I'm going to demonstrate now how to get our first dental x-rays. We do use a digital system, we don't use any film here. And since our patient is on our side, and normally we would prefer a sternal incumbency, but we're on our lateral side because his head is very heavy. And he has the potential to crush our plate that we put in the mouth. So I am going to start with his incisors by placing this directly onto his incisors, not too far in the mouth. I want to make sure I get the roots and the caps, or on the crowns. Lift his head a little bit. And using the parallel technique, we're going to shoot directly at the plate. I come over here, and then I just request my shot, so getting all of the 103, 102, 101, 201, 202, 203, so that is the right and left incisors. And we are going to, we all have our x-ray badges on, and we all stay 6 feet away from the primary beam. We will say clear, and we shoot our x-ray.
Shooting.
Okay, let's double check our shot. Okay, so I have, let me see here, we have 3, 2, 1, 1, 2, so I did miss an incisor here, but that's okay, we can always come back to that. So the next shot I'm going to do is that canine shot, so I can tell which side of the mouth I was on. It looks like here, so we have 101, 101, 102, 202, 203, I'm sorry, 201, 202, 203, so we're going to try to get 204, which is the canine, and I want to try to get that root. I'm going to use some gauze here and hold this into place. And again, using the parallel technique. Shooting through almost the sinus cavity to get our canine root, because it is a very deep root. The left side is the 200s. So let's try to shoot this again. We're clear.
Shooting.
No, I want to get her first in case she tries to be on the table, because we want it to be thrown.
And okay, so I do have the root here. Ideally, I would have a better shot. I'm a little overlapping, but we can try to shoot that again. So let me just do a little adjustment here, and I'm going to kind of angle my beam a little bit. And just try to get that one more time.
Clear. Shooting.
Okay, this is a much better shot of our canine root, and that is how we start with our dental x-rays. Ready? So now I'm going to be demonstrating how to ultrasonically scale a canine's teeth. You see that there's a lot of tartar here, a lot of plaque. So I'm going to hold this like a pencil and use the side of my probe here with the water running. And you want to make sure the water is going at a nice decent speed because the probe can overheat. And you want to spend no more than 10 to 12 seconds per tooth because you can damage the enamel in the tooth. And I'm just kind of going up and down on the tooth, making sure to pull off as much as I can in my time limit. I'm also going to go underneath the gums a little bit. Again, making sure to not spend too much time on the teeth themselves. Start down here. And then there are going to be areas on the teeth that you cannot scale as easily on. And in that case, we would use a manual scaler. And I can show how to do that when we're finished scaling our main teeth. So now that we have used the ultrasonic scaler to start scaling the teeth, you can see that there's, actually for example, there's a piece of tartar right there on that endotracheal tube. I'm going to start manually scaling the teeth. So you can do that. So with this instrument here, this manual scaler, it's very sharp, very pointed. So I can use this, for example, with the carnasal and get kind of in this spot here that the ultrasonic scaler can't reach in into these grooves. There's not much here. And then as well as I can use this one here. This has a curved end here. And what I'm going to do is not use the tip of this, but use the side of it. And for example, in this carnasal, I'm going to go underneath the gums and just kind of pull. And you can feel that it's a little bit rough. And just pull straight down. So you can actually see that you're getting that little bit of extra tartar that the ultrasonic scaler missed. And I do expect the gums to bleed because there is, there is some dental disease in here. There's some periodontal disease. So that's okay if we do bleed a little bit. But that is how you manually scale a dog's teeth. One of the final parts of any dental cleaning is polishing. So making sure to get a lot of polishing paste on my instrument here. And you don't want to spend too much time on each tooth, but just enough time. And you don't want to apply enough pressure as well. So as long as there is always paste, you can apply it on the teeth. So I'm not pushing too hard because I can bruise the tooth. Like that. And that is how you polish a dog's teeth. Good evening. Larry was here today for his dental procedure. Overall, Larry did very well. Here is the document we're going to send home with you. This is his dental discharge. This goes over just the teeth that are inside a dog's mouth. Gives you what we did today. So we scaled, we polished, and we applied fluoride. He didn't actually have any extractions this time around. So with any diet instructions, we would recommend that he return to his normal diet. He did get an antibiotic injection because when we scale the teeth, there's still the ability to inhale the aerolized bacteria. So we gave him an antibiotic injection that you don't have to worry about. We're also going to send you home with a product called Cleansident. It works as a enzymatic mixture that you put in with the food, and it's supposed to help prevent any additional tartar buildup now that he has nice clean teeth. Do you have any questions for me regarding further dental care?
Can I feed him his normal diet?
Yes, you can feed him his normal diet. We usually recommend for canines or felines to eat a dry food. That way it helps break down tartar more. If you're worried about him going further and getting another dental in a couple years, we'd recommend some at-home dental care. So again, now that he has some nice, fresh, clean teeth, you can brush his teeth at home. Easier said than done. We recommend using an enzymatic cleaner, which kind of acts as like scrubbing bubbles, so it does the work for you. And you really want to make sure you get in there because the manual movement of the brush really helps break down any existing tartar that's there. And I think that's it.
Okay, thank you.